Brain fog, anxiety, mood swings, and everyone tells you it's just aging. But the truth is, there's more, and hormone therapy might completely change your life. Let me show you how. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Back home in Nigeria, we have a saying, the same sun that melts wax hardens clay. Perimenopause can feel like that burning sun, overwhelming for some women, yet surprisingly transformative for others. I'll show you how to make this transition a positive one. Let me paint a picture that might feel familiar. You're standing in your kitchen, staring at the open refrigerator, completely blank on what you came for. It's like your thoughts are stuck in slow motion. At work, you struggle to find words during presentations that used to flow effortlessly. Night after night, you wake up drenched in sweat, your heart racing for no reason, and your mood, it swings so wildly that your family has started walking on eggshells around you. You finally gather the courage to see your doctor, hoping for answers, for relief. And what do they tell you? It's just aging. Here's an antidepressant. Maybe try some yoga. As if you're supposed to accept feeling like a stranger in your own body and mind. I see this pattern quite often. Women in their 40s and early 50s are struggling through perimenopause, being dismissed, being overmedicated, and being told to just push through. However, the truth is that modern science has significantly altered our understanding of this transition. And one of the most powerful tools we now have is hormone therapy. Not the synthetic chemicals from the past, but rather bioidentical hormone therapy, which is much safer. I know what you're thinking. Isn't hormone therapy dangerous? What about cancer risks? Didn't that big study show it causes heart problems? Let me address that directly. In 2002, headlines screamed about the dangers of hormone therapy based on the Women's Health Initiative study. However, what most women are unaware of is that this study has been widely misinterpreted. Many of the participants were in their 60s and 70s, already well past menopause, using synthetic hormones, not bioidentical hormones. Modern research shows something completely different. For most healthy women in their 40s, 50s, and early 60s, hormone therapy is not only safe, but often protective for your heart, bones, and brain. Let me tell you about my patient Maggie. At 47, she came to me feeling like she was losing her mind, a successful executive who was struggling with brain fog, anxiety, and mood swings. 3 different doctors had prescribed 3 different antidepressants. None helped. Some made things worse. She was tearful and overwhelmed when we met for the first time in my office. We conducted a comprehensive evaluation, including micronutrient testing and hormone panels, then started her on pharmaceutical-grade supplements and hormone therapy. A few weeks later, Maggie called back in tears, happy tears this time. She said, I feel like myself again. I didn't realize how much I'd lost until I got it back. Maggie's experience isn't unique. I've seen this transformation hundreds of times. The benefits extend far beyond simply feeling normal again. Let me share the 5 most remarkable benefits that my patients experience with properly managed hormone therapy during perimenopause. Benefit number 1, mental clarity. That brain fog that makes you forget words, lose your train of thought, or stare blankly at your computer. Hormone therapy helps with this. Estrogen actually supports the chemicals and connections in the brain. When we restore optimal hormone levels, women report feeling sharp, focused, and mentally agile again. One study found that hormone therapy may help preserve certain brain regions in women at risk for dementia, and that there could be beneficial effects if hormone therapy is started close to menopause in women with specific dementia risk factors. Benefit number 2, emotional stability. The unpredictable mood swings, anxiety, irritability, and even depression that can come with perimenopause often stabilize with hormone therapy. This isn't just masking symptoms like antidepressants might do. It's addressing a root cause. Estrogen and progesterone directly influence the action of serotonin, GABA, and other neurotransmitters that regulate mood. When these hormones fluctuate wildly or drop, your emotional regulation gets affected. Restoring balance often brings back emotional resilience. One patient told me, for the first time in years, I feel like my reactions match the situation. I'm not crying over spilled milk or raging over minor inconveniences. I feel proportional again. Benefit number 3, sleep quality improves. Those night sweats that leave you drenched, the 3 a.m. wake-ups where your mind starts racing and won't stop, Hormone therapy can improve insomnia. Quality sleep is essential for mental health. When you're sleeping deeply again, things improve. Your mood, your thinking, your energy, your relationships. Studies have found that hormone therapy can enhance the quality of sleep in peri- and postmenopausal women, especially those experiencing vasomotor symptoms like hot flashes. Benefit number 4. Energy and vitality return. That bone deep fatigue, complete lack of motivation, and feeling that you're just dragging yourself through each day. Many women see dramatic improvements in energy levels with hormone therapy. Estrogen influences your mitochondria, the powerhouses in your cells that generate energy. When estrogen drops, mitochondrial function can decline. Restoring optimal hormone levels often brings back that vital energy that makes life enjoyable rather than just survivable. One of my patients, a 49-year-old artist, had stopped painting entirely because she just couldn't find the energy. 3 months after starting hormone therapy, she completed her first new collection in 2 years and staged a successful exhibition. But perhaps the most remarkable benefit, number 5, hormone therapy protects your long-term brain and body health. This isn't just about feeling better now, it's about protecting your future self. Multiple studies show that women who start hormone therapy during the perimenopause to early menopause window have a significantly reduced risk of Alzheimer's disease and cognitive decline. Beyond brain health, appropriate hormone therapy is associated with reduced risk of heart disease, osteoporosis, colon cancer, and even diabetes when started in that critical window. According to a Chinese proverb, the best time to plant a tree was 20 years ago. The second best time is now. If you're in perimenopause or early menopause and struggling, now is your time to consider whether hormone therapy might be right for you. Of course, hormone therapy isn't for everyone. Women with a history of or active breast cancer, liver disease, or a history of blood clots may need different approaches. That's why working with a knowledgeable provider who can personalize your care is essential. In addition to hormone therapy, other lifestyle modifications can help you live a more fulfilling life during this transition. I have a free guide in the link below that walks you through several of these strategies. And if you're wondering about natural supplements to complement hormone therapy, then check out this next video. I discuss the top 5 supplements every woman over 40 needs to know.